understand, if this reform becomes law, members of Congress, they'll be getting their insurance from the same place that the uninsured get theirs. Because if it's good enough for the American people, it's good enough for the people who send us to Washington. So basically what would happen is we'd set up a pool of people, millions of people across the country would all buy into these pools that give them more negotiating power. If you work for a big company, you've got a better insurance deal because you've got more bargaining power as a whole. We want you to have all the bargaining power that the federal employees have, that big companies have, so you'll be able to buy in, or small business will be able to buy into this pool. And that will lower rates, as estimated, by up to 14 to 20% over what you're currently getting. That's money out of pocket. And what my proposal says is if you still can't afford the insurance in this new marketplace, then we're going to offer you tax credits to do so. And that will add up to the largest middle-class tax cut for health care in history. That's what we're going to do. Now, you know, when I was talking about this at that healthcare summit, some of you saw, you know, I sat there for about 7 hours. I know you guys watched the whole thing. But some of these folks said, well, you know, that's a nice idea, but we just can't afford to do that. So look, I want everybody to understand, the wealthiest among us can already buy the best insurance there is. The least well among us, the poorest among us, they get their health care through Medicaid. So it's the middle class, it's working people that are getting squeezed, and that's who we have to help, and we can afford to do it. Now, it is true that providing these tax credits to middle-class families and small businesses, that's going to cost some money. It's going to cost about $100 billion per year. But most of this comes from the nearly $2.5 trillion a year that Americans already spend on health care. It's just right now, a lot of that money is being spent badly. So with this plan, we're going to make sure the dollars we make, the dollars that we spend on health care are going to make insurance more affordable and more secure, and we're going to eliminate wasteful taxpayer subsidies that currently go to insurance companies. Insurance companies are making billions of dollars on subsidies from you, the taxpayer, and if we take those subsidies away, we can use them to help folks like Lantoma get health insurance so she doesn't lose her house. And yes, we will set a new fee on insurance companies because they stand to gain millions more customers who are buying insurance. There's nothing wrong with them giving something back. But here's the bottom line. Our proposal's paid for, which, by the way, is more than can be said for our colleagues on the other side of the aisle when they passed that big prescription drug plan that costs about much as my health care plan, and they didn't pay for any of it and went straight to the deficit, and now they're up there on their high horse talking about, well, we don't want to expand the deficit. This plan doesn't expand the deficit. Their plan expanded the deficit. That's why we pay for what we do. That's the responsible thing to do. So let me talk about the third thing, which is my proposal would bring down the cost of health care for families, for businesses, and for the federal government. So Americans buying comparable coverage to what they have today, I already said this, would see premiums fall by 14 to 20%. That's not my numbers. That's what the nonpartisan Congressional Budget Office says. For Americans who get their insurance through the workplace, how many people are getting insurance through their jobs right now? Raise your hands. All right, well, a lot of those folks, your employer, it's estimated, would see premiums fall by as much as 3,000%, which means they could give you a raise. have incorporated most of the serious ideas from across the political spectrum about how to contain the rising costs of health care. We go after waste and abuse in the system, especially in Medicare. Our cost-cutting measures would reduce most people's premiums and bring down our deficit by up to $1 trillion over the next 2 decades. Those aren't my numbers. Those are the numbers determined by the Congressional Budget Office. They're the referee. That's what they say, not what I say. Now, the opponents of reform, they've tried to make a lot of different arguments to stop these changes. You remember, first they said, well, there's a government takeover of health care. Well, that wasn't true. Then they said, well, what about death panels? Well, that didn't turn out to be true. You know, the most insidious argument they're making is the idea that somehow this would hurt Medicare. I know we've got some seniors here with us today, so I couldn't tell. You guys look great. I wouldn't have guessed. But I want to tell you directly, this proposal adds almost a decade of solvency to Medicare. This proposal would close the gap in prescription drug coverage called the donut hole. You know something about that. That sticks seniors with thousands of dollars of drug costs. This proposal will over time help to reduce the cost of Medicare that you pay every month. This proposal would make preventive care free so you don't have to pay out of pocket for tests to keep you healthy. So yeah, yes, we're going after the waste, the fraud, the abuse in Medicare. We are eliminating some of the insurance subsidies that should be going to your care. That's because these dollars should be spent on care for seniors, not on the care and feeding of the insurance companies through sweetheart deals.